Hello. In this video, we are going to talk about compassion fatigue. Compassion fatigue is also called vicarious trauma, secondary traumatic stress, and oftentimes you'll hear it titled burnout. For the sake of this video, I'm going to be using the term compassion fatigue. So compassion fatigue is typically defined as the cost of caring for other people's pain and suffering. It's secondary exposure, not primary. So it would include things like witnessing trauma or violence. It could be hearing it, reading about it. All of this causes almost like an absorption of that trauma. And that could be manifested in a lot of different ways for a lot of different occupations and professionals. This could include social workers, law enforcement. It could include teachers, journalists, people that work at humane societies with animals, domestic violence, sexual assault advocates, peer support workers, anyone that is working in a profession in which they are talking to people that have histories of trauma. And they may hear the details of it, or they witness the actual violence. There's many signs to compassion fatigue, and some of the main symptoms or signs include cynicism and bitterness, not doing the things that you love or bring you joy, maybe not spending as much time with the people that you love, your friends and your family. It can also include, difficulty sleeping, or even PTSD symptoms like nightmares, intrusive thoughts, hypervigilance. Like PTSD, there is a change in worldview for professionals who are working with trauma survivors. Laura Lipsky-Danut, who wrote the book Trauma Stewardship, talks about her experience as a trauma therapist. She'd been working in the field for about a decade, and she goes on a vacation with her family in a really beautiful island. They climb up this high hill, and they are looking at just all this beauty. There's blue sky, there's ocean, there's birds, flowers, trees, and everybody is oohing and eyeing and taking pictures. Laura, however, is looking over the edge, and she says out loud, "I wonder how many people have jumped off here to kill themselves." Everyone else is there on that hill enjoying the beauty. Laura, however, is still with her clients. And that experience that she has with her clients has come with her, and it has changed how she sees the world. And that happens with a lot of different professions. So with child welfare workers, they may be in the grocery store one day. They're not working, but they see a child with a bruise on their arm, and they start ticking through all the assessment questions and clues and signs that you would see. What size is the bruise? Does it look like it, a hand grabbed that child's arm? I've talked to people that worked in law enforcement or corrections or security that even when they're on vacation, or maybe they're even just out with their family, they're looking for criminal behavior. And then there's domestic violence, sexual assault advocates. And because they work in a field that is constantly identifying and helping other people identify domestic violence, sexual assault, trafficking, stalking, dating violence, they see it everywhere when they're trying to maybe date themselves. So it changes our worldview. And although there may be parts of our worldview that are still there, sometimes our mind goes there. And you may not notice it yourself. That's why I think a quick assessment sometimes is really nice. And a quick assessment is just asking the people around you that love you and know you, have I changed? Have you seen a difference in me? Now, there are also assessment tools that can help you identify the signs and symptoms of compassion fatigue. And those can be found on this video's resource list. There's also risk factors, or factors that increase the likelihood that you could experience compassion fatigue. And those include having your own history yourself. And that's not uncommon. Many people with histories of trauma are drawn to a helping profession. But it can also increase your vulnerability to compassion fatigue. Other factors include isolation, and what that looks like is working possibly in an agency where you're the only one doing a particular job and you don't have anyone to debrief with or anyone that kind of understands your experience. It can be working with clients that are marginalized, that are in poverty, that are oppressed. Working with children who have been abused, it certainly increases your chances of compassion fatigue. And then, of course, things like low pay, lack of resources, and high caseloads. So it's important to look at, not just for symptoms, but also to look at, are you in a profession that has more vulnerability to it? And how does your agency respond to its workers in terms of self-care and preventing and intervening on compassion fatigue? So what do we do about this? Well, there's organizational response and then there's personal response. So if you're someone that is working at an agency where maybe you supervise people, or perhaps you are the CEO of organization or on a board of directors, it's important that you prioritize taking care of your staff. And it certainly helps if you can give them benefits such as mental health days, and making sure that they have insurance that can provide them the professional support that they may need. But it also includes creating a culture within your organization that allows people to talk about it. Oftentimes what happens is people feel that if they do say that they're being impacted by their work, that means they can no longer do the work. And that's not the case. You're a human being and you're going to be impacted by this work. There's a wonderful quote from The Kitchen Table, which is a book, and it says that the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as walking in water and not getting wet. Everyone is going to be impacted. It's just that you're going to be impacted in different degrees and for different lengths of time. But organizations that talk about it, they're more likely to get ahead of it. They're more likely to talk to their staff to find out what their needs are. It may be as simple as allowing people to divide up their direct care and non-direct care work, where they're able to take a time out from maybe having that direct service happen for 8 hours a day. You can work with your employees in a trauma-informed way to find out what they need to remain healthy while doing the work that they love. So that's organizational, but there's also personal. And that also includes making sure that you are able to talk about being impacted. Once you feel some of the signs that I talked about, whether it's cynicism or bitterness or anger or nightmares, it's important that you begin to speak to someone about that. And believe me, your coworkers have felt it as well. And talk about maybe how to manage that, how to cope with that. Now, I think everyone that works in the field of trauma has already developed ways in which they cope. Sometimes those are healthy ways and sometimes they're not so healthy ways. So my story with compassion fatigue actually happened in the 90s, and I was working at a child care organization, working with children in psychiatric programs. And I had been doing that for probably about 3 years at that point. And I was also at the time an active alcoholic. I was working with a child one day, and the child was in crisis, and I was spending some time doing what we called a teaching interaction, in which I was trying to talk to the child versus using restraint, physical restraint, and de-escalating the situation. This de-escalation lasted probably about 20, 25 minutes, which at the end we were both exhausted. This 7-year-old boy, who had been in this facility for 2 years already, sat on the couch with me, put his little head on my shoulder, and said, "Will you take me home and be my mommy?" Now, we all have stories like that. We have hundreds of stories like that, the ones that break our heart. Now, what I did after that is I went home and drank myself into a blackout. That is how I coped, because that was the only way that I could stop seeing his big brown eyes and think about what his life was like. So that's compassion fatigue. That's vicarious trauma. Now, I did end up quitting that job because of that. But when I went in to talk to the CEO of the company, I didn't say I have compassion fatigue. I didn't know what it was called. And I certainly didn't tell her that my heart was so broken that I was drinking myself to sleep. But there were so many things in hindsight that could have been done in that situation. And it all would have started with talking about it. And the people at the top talking about it and owning their own compassion fatigue and role modeling that for the people that work for them. Giving them primary permission to do things personally and professionally that can maintain their health. Now, there are things that people can do to help themselves, and I'm just going to mention a few. I've talked about the first step is talking, of course, and that may be also doing some self-reflecting, some assessment, and just prioritizing your well-being. Now, are going to be a long list of resources on this video's resource list, but I'm going to give you just a few tips to get started. One is increase joy. Increase things that bring you joy, that make you feel connected. Oftentimes, when we do have compassion fatigue, we stop doing things that feel good. We stop our hobbies, we stop having coffee with people. And the reason is usually I am exhausted. I don't have anything left. And that is the time that you do want to connect with things that make you happy. Playing with the kids, walking the dog, getting back into those things that kind of elevate you, fill your cup, offer replenishment. At the same time, you want to look at how much trauma am I inviting into my life? And you want to regulate your trauma input. So there was a time in my life where I would get up in the morning and I'd watch the news, trauma, right? And then I would go to work, 8 hours of working in trauma. I'd come home, 5 o'clock news again, trauma. And then I'd sit down and watch Law and Order SVU because I haven't had enough sexual assault in my life today. And then I would watch the news once again or doom scroll on my phone at all the news that just gets kind of thrown at you from your phone. And lastly, I would crawl into bed and read my favorite serial killer book. That is a lot of trauma. I was inviting all of it in. I was making choices throughout the day that brought that trauma into me. So I can change that. I can fast from the news. I can decide what I'm going to read. And I can also balance it where it's not trauma all day. So those are just a couple of tips. And again, I mentioned that you may want to go to the video resource list that will offer you additional information on how to care for yourself and to continue doing the things that you love.